I have some of India's top doctors joining me. I'm joined by Professor Giridhar R. Babu, Professor of Epidemiology from Bengaluru. I'm also joined by Dr. Om Srivastav of the Maharashtra COVID Taskforce, also with Jaslok Hospital, and Dr. Suranjit Chatterjee, Senior Consultant at Indraprasth Apollo Hospital. Dr. Chatterjee, I'll start with you first, because really what we're seeing in Delhi seems so heartbreaking. That young person who just died at 35 years old. Why is it? And you've, of course, been through the first wave and now this again in Delhi. Are you seeing that patients are getting much younger? Why is it that young, healthy people are getting impacted so badly in the second wave?
See, this is what happens in most of the pandemic things. When the second wave comes, and this was true with the Spanish flu also, which happened in 1918, that the first wave mostly affects the people who are vulnerable, who are people with comorbidities. When the second wave comes, it actually attacks more of the younger people, and also this time it obviously seems that the vaccine, that the virus has changed its character, it has mutated, and is also affecting the younger people. You are absolutely right that this time the number of younger people affected is much larger than the first wave, and we are seeing people with higher oxygen requirement, really requiring high flow oxygen. Also contributing to their morbidity is the fact that the beds and the ICU facilities are available less, and quite a few people are succumbing to it because of the lung involvement, which is huge, and also because of, in a few cases, obviously, because of lack of facilities available to them to treat them.
Professor Giridhar Babu, if you can come in on the epidemiologist view, is this, as Dr. Chatterjee said, is this expected in a sense that this is the second wave of it? But is it a mutation of the virus, this new B167 strain, which is leading to healthy people, young people being impacted so badly? How would you interpret this analysis? And would you say that young people are more at risk, because it's still the older people? How would you actually look at this now, Professor Babu?
Yeah, hello, Sonia. I don't think this virus has any particular predilection for younger age groups. If you compare the data for 20 to 30 years and also from 30 to 40 years, the proportion of people getting affected from this virus, whether the earlier variant or the newer variants, is almost similar. It was around 21% in the 20 to 30 years age group, and also around 22% in the 30 to 40 age groups. While the proportion is still the same compared to the first wave, because the number of people who are getting infected are more, if you see the quantum of cases because of the newer variants, the same proportion will result in more number of cases. And a fixed proportion of every age group is definitely at risk of receiving critical care. And if those with mild and moderate, especially young people with mild illness, they might ignore, or they might find out that they have respiratory distress a little later. And if there are not enough beds, then they progress very fast into severe respiratory distress. So while the proportion might be lower, the shortage of beds and also delay in identification makes them more vulnerable for death, Sonia.
So in that sense, Dr. Srivastav, if you could come in, because of course, first, the good news is that Maharashtra seems to have turned a curve with the latest numbers. But when you were really in the middle of this storm in Mumbai, what did you see in the differences between what the first wave and the second wave was? One difference between Mumbai and Delhi seems to be that much less oxygen was used for Mumbai patients than it was for the same number of Delhi patients. Do you think it's because there were different variants in play in Mumbai and Delhi, or how would you see it?
So, two different questions. Whether the total amount of oxygen requirement was in any way lesser, I doubt that, because most times what happens is that in the early part of the disease, in the milder variants, you don't really need a lot of oxygen. Most people can do with about 1 to 2 liters of oxygen. The problem is when the disease gets to be moderate or moderate to severe, that's when your requirement of oxygen becomes from 4 to 6 liters, 10 liters, 20 liters. So that's a different story altogether. Oxygen requirements, I don't think there's going to be a very big difference. Disease patterns are about the same everywhere. But the question that you were asking, I think that between the first wave and now, there is a difference in the involvement of certain organs, especially the heart of patients. And for some reason, there does appear to be a younger predilection of these people. And so we are finding a lot of people, younger, mostly younger, but younger or otherwise, having sudden deaths. People who are dying of a condition called myocarditis, people who are having conduction abnormalities, and who are succumbing to the infection even after they have gone home. Somebody in his 30s or 40s goes home and then comes back 2 days later. That patient is brought dead on arrival into hospital. So for sure there is a different variant that affects people in different organs, and the involvement of the heart is definitely more in this wave of COVID. As to why that's happening, that's probably going to require a far more detailed study before you can come up with a clear answer.
So what do you do so then we know it's to watch out for that. So what do you do if you're a young patient or somebody who thinks they've recovered? How do you watch out for this symptom, or how do you watch out for this sudden death, as you put it?
No, so the thing to do is to, when you see your patient for the first time, is what you do is a risk assessment. That means, does the patient have A, B, C, D, E, F, G, H, I, or whatever number of criteria? If your patient has that many number of criteria that he or she is meeting, then you treat that patient aggressively from day zero. You don't wait for complications to occur. You make sure that you're preempting, whether you're doing it as blood markers, laboratory markers, whether you're doing it with CT scans, whether you're doing it with echocardiograms, ECGs, or simply by clinical bedside assessment. Whatever you are using as a tool to make that assessment, you need to keep doing that again and again. And even with people who are asymptomatic, who would like to tell you that I'd like to go home at the end of, say, 5 days or 7 days because he doesn't have a problem or she doesn't have a problem, you've got to be careful about not sending such people simply to go home and be by themselves, because they are the ones who need more attention. And that is the only way that you can preempt somebody who's likely to be going into a complication.
So you're saying actually be extra cautious, rule out all possibilities. But Dr. Chatterjee, if I could bring you in here, what in your assessment, we talked about the younger people, but what do you see as the biggest difference, for instance? Do you see symptoms coming up much faster? Earlier we would say that perhaps day 8 to 12 or say would be the really danger days. Do you see that that all is changing? And on the one hand, you hear the government and doctors saying home isolation, monitor your symptoms, don't worry. But the reality perhaps a little bit different when it happens to people who are not seen as predisposed to fatalities of COVID.
See, at ground level, what we are seeing is whatever the numbers show is a different thing. But at ground level, what we are seeing is that younger people this time are getting much more affected than what we saw during the last wave. We are seeing at the ground level that they're becoming much more sick than what was there in the last wave. There's no doubt about that. What we have seen and observed is that the oxygen requirement this time is much higher in these people and at a much earlier stage. Earlier, when we would recommend like the blood marker reports and all that, we would say that get it done around the 8th day of the onset of symptom. What we are doing this time, because what we are seeing is that they are requiring oxygen maybe on the 5th day or the 6th day. So what we are doing is that we have preceded the number of days by about 2 days or so that we can investigate them earlier, and we know that their markers are how are their markers behaving, how is it clinically behaving. So definitely we are observing this time that the disease is becoming slightly more serious at the ground. I'm talking all at the ground level, that the disease is becoming more serious earlier than what it used to be during the last time. We definitely are seeing more oxygen requirement. Obviously, I think the oxygen has to be rationalized. You don't need a 95, 97% oxygen to treat everybody. You need maybe 90, 92% oxygen to treat people to maintain the saturation. But definitely things are different this time. The markers are rising earlier. The disease is becoming more serious earlier. And also, as you said, that home treatment, when we are doing the home management, they have to, the doctors who are treating and the patients who are being treated at home need to be very careful, and they need to be counseled as to the need of when should we do the test, what are the signs that we are looking at, because a lack of low oxygen level or even a persistent fever beyond a certain days is an important sign which people have to be counseled when they are doing home treatment.
Right, and I think that's what we need to be perhaps all on the same page on the seriousness of the situation. Of course, we shouldn't create panic, but I think also perhaps when press conferences are had, that everybody needs to be on the same page rather than controversies. But I want to ask you, Professor Babu, again as an epidemiologist, when we look and the recent samples showed that perhaps Delhi had more of a strain of the UK variant, that Maharashtra had more of a strain of B1617. Of course, that keeps changing around. But do you see these as completely, in a way, different variants that we are fighting needs different treatment? How are doctors, how are patients meant to assess? You're seeing so often in families that both the husband and wife are very seriously impacted, it's not that one is severe and one is mild. Both get it very severely.
Yeah, Sonia, I think irrespective of the variants, there seems to be more variants in circulation in India, both imported and the indigenous ones. But let me just look at the data. I agree with the doctors in terms of the number of people who are seeking care in the younger age groups is definitely high. But if you look at the data at the national level, the highest mortality is in the age group of 60 to 70, which is around 21.8%. And in the younger age groups, if you look at from 10 to 20 years, it is 0.31, and from 20 to 30, it's just 1.72%. And from 30 to 40, it's just around 5.3%, which means that the proportion of younger people getting severe infections or in terms of death is far lower compared to the older age groups. But 5% of lakhs of active cases means a really large number. Since the first wave was small in terms of the peak, we did not see that many cases. But in the second wave, because it is more contagious, because more people are getting infected, even the 5% in the 20 to 30 years group, 1.72% in the 20 to 30 seems to be a very large number. I'll agree with the doctors again. Right. We should not panic, especially for the young people. Don't ignore thinking that you are immune or you are better protected. Watch out for your respiratory distress, especially around 7th day is when most people are seeing this. Have a pulse oximeter. If you think the oxygen saturation is going down, immediately make sure you are getting oxygen.
No, but of course the question now is, even if it goes down, where do they get a hospital bed? That of course is not your area of expertise, but thank you. And also I think data needs to be updated, because the last ICMR data on this age group, sir, was about, I think, 2 to 3 weeks ago. So I think we need to also have a rapid updating of data and sequencing. But thank you very much, all of you, for joining me.